The root canal is the portion of the pulp space from the canal orifice to the apical foramen. For convenience may be divided into three sections, namely हो गया coronal, एक हो गया middle, हो गया एक apical third हो गया. Coronal, middle and apical third हो गया. Accessory canals are lateral balancing of the main root canal, generally occurring in the apical third or furcation area of the root. Lateral canal is an accessory canal that branches to the lateral surface of the root, may be visible on radiograph. Apical foramen is an aperture at or near the apex of a root through which is blood vessels and nerve of the pulp enter the leaves. दिन भर तो कॉलेज में ही रहते हैं, 3 बजे 3:30 तो रूम पे आता है क्या चाहिए. हाँ चिल्ला रही है. एक ही हो गया, जैसे कि हो गया correct treatment begins with a correct diagnosis. Arriving at a correct diagnosis requires knowledge, skill and art. Knowledge of the disease and their symptoms हो गया. Skill to apply proper test procedure and the art of synthesizing impressions fact. Correct diagnosis requires knowledge, skill and art of knowledge of the disease and their symptoms. Skill to apply proper test procedure हो गया, and art of the synthesizing impressions facts and experiencing into understanding. जैसे देखो definition हो गया, जैसे diagnosis is the correct determination, discriminative estimation and logical appraisal of condition. हाँ found, हाँ भाई found during examination as evidence by distinctive sign mark and symptoms हो गया. जैसे diagnosis is also defined as the art of distinguishing one disease from another. देखो definition हो गया, जैसे कि diagnosis is the correct determination, discriminative estimation and logical appraisal of conditions found during examination as evidence by distinctive sign marks and symptoms हो गया. Diagnosis is also defined as the art of distinguishing one disease from another. Diagnostic procedure should follow a consistent logical order that includes a comprehensive medical, dental history, radiographic examination, extraoral and intraoral clinical examination, including histopathologic examination, to arrive at the final diagnosis when required. The process begins with the initial call requesting an appointment for some specific reason, usually a complaint of pain. Subjective information is supplied by the written history of question and that each patient complete and sign. Further information is obtained by clinicians who review the question and ask a specific question regarding the patient's chief complaint, past medical history, past dental history and present medical and dental status, and clinicians should not hesitate to consult the patient's physician whenever a patient appears to be medically compromised or when the gained information is inadequate or unclear. More often than not, a patient medical problems affect the course of treatment, especially concerning the use of anesthetic antibiotic. Especially आपको कंसर्न करना है anesthetic का, antibiotic का और analgesic का. Occasionally the patient medical status bears symptoms are the unit of information should in clinical diagnosis. They are defined phenomena, sign a departure from the normal state and are indicative of illness. Symptoms can be classified as such a subjective symptom हो गया, those experiences and reported to the clinical by the patient. Objective symptoms हो गया, those ascertained by the clinician through various tests. Objective, subjective and objective. Complete medical form concerning the patient past medical and dental history consists of subjective symptoms. Included in this category is the patient's reason for seeing the dentist or chief complaints. Generally, a chief complaint relates to pain, swelling, lack of function of aesthetic. Diagnosticians in developing a tentative diagnosis quickly, one should ask for patient about the kind of pain, its location, its duration, what causes it, what alleviates it, whatever or not it has been referred to another site. Generally, pulpal pain is described patient on the following ways. जैसे कि sharp होगा, this type of painful response is consisting of the usually associated with excitation of nerve fiber in pulp. Dull होगा, this kind of painful response consists of those resulting from the excitation, slower rates of transmission of C fiber in the pulp. Determine category of the pain is important in suggesting the next group of question to be asked. जैसे लोकेशन हो गया, the ability to localize the pain is obviously important, and localized pain is localized when the patient point is specific. Clinical features हो गए, जैसे कि pain is the most common clinical feature associated with hypersensitivity. The intensity of pain vary from mild to discomfort to severe sensitivity. The pain is typically rapid in onset. The pain is typically rapid in onset, sharp in character, and of short duration. Okay, external stimuli that can elicit expression of this condition include thermal stimuli, hot, cold foods, beverages, cold blast of air. Osmotic stimuli हो गया, sweet food हो गया, एसिडिक स्टिमुली हो गया, साइट्रस फ्रूट्स हो गया, एसिडिक बेवरेजेस हो गया, मेडिसिन हो गया, मैकेनिकल स्टिमुली हो गया, टूथब्रश हो गया, डेंटल इंस्ट्रूमेंट हो गया. द मोस्ट कॉमन इन्वॉल्व टूथ आर एज फॉलो: बकल सरफेस ऑफ प्रीमोलर, लेबियल सरफेस ऑफ इंसाइजर. डिसेंसिटाइजिंग द नर्व हो गया, पोटेशियम नाइट्रेट हो गया, ऑक्लूडिंग द डेंटाइनल ट्यूबल्स हो गया, रीसेंट एडवांसेस हो गया, आर्गिनिन हो गया, कैल्शियम सोडियम फॉस्फोसिलिकेट हो गया, सॉल्ट और आयंस हो गया, 0.4% स्टैंस फ्लोराइड हो गया, 2% सोडियम फ्लोराइड हो गया, पोटेशियम ऑक्सलेट हो गया, स्ट्रोंटियम क्लोराइड हो गया, सिल्वर नाइट्रेट हो गया, ग्लूटाल्डिहाइड हो गया, जिंक क्लोराइड हो गया, डेंटिन एडेसिव हो गया, डेंटिन बॉन्डिंग एजेंट हो गया, कंपोजिट्स हो गया, ग्लास आइनोमर हो गया, क्राउन रिप्लेसमेंट हो गया, पेरिडोनटल ग्राफ्टिंग हो गया, लेजर्स हो गया. Arginine is being incorporated in the numbers of recently developed toothpaste जैसे कोलगेट हो गया, सेंसिटिव, प्रो रिलीफ कोलगेट, पाल्मोलिव कंपनी न्यूयॉर्क, कोलगेट सेंसिटिव, प्रो रिलीफ कोलगेट. The combination of arginine with calcium carbonate and phosphate result in precipitate formation on the open dentinal tubules. In addition, in toothpaste, it is available in several forms such as arginine in office paste and arginine in mouthwash. Calcium sodium phosphosilicate. Novamine is the trade name for CSPS bioactive glass. It acts by occlusion of dentinal tubules by precipitating calcium and phosphate. Calcium and phosphate ions react with oral fluids to form hydroxycarbonate apatite layer that is similar to natural tooth structure. It is available in the form of toothpaste 5% CSPS and prophylaxis paste 15% CSPS. Sensodyne repair and protect dentine adhesive. Dentin adhesive हो गया, the use of dentin adhesive to treat hypersensitivity. Hypersensitive dentinal surface has gained popularity. Reduction in sensitivity can result from formation of resin tags and hybrid layer when dentin adhesive is used. Objective symptoms हो गया, objective symptoms are determined by tests and observations हो गया performed by the clinician. These tests are provided in box, although it may not be necessary to perform all these tests at any one time. Combination of corroborating test is desirable to ensure a correct diagnosis and should not rely on the result of any single test. Visual and tactile inspection. The simplest clinical test is visual examination. Tooth often it is done casually. casually eat during examination and result much essential information is lost and through visual and tactile examination of hard and soft tissue relief on checking the hard tissue हो गया to teeth the teeth should be visually examined using the 3 a normal appearing crown as a lifelike translucency and sparkle that is missing in pulpless teeth. Teeth that are discolored, opaque, and less leaf life-like appearances should be carefully evaluated because the pulp may already be inflamed, degenerated, or necrotic. देखो हार्ट टिश्यू सॉफ्ट टिश्यू जंजाइवा पेरिडोंटियम परकसन palpation mobility and depressibility bite test radiography intraoral periapical radiographs bite wing radiographs digital radiography cone beam computed tomography assessment of pulp vitality neural sensitivity test हो गया thermal test हो गया heat testing हो गया cold testing हो गया इलेक्ट्रिक पल्प टेस्ट हो गया एनेस्थेटिक टेस्ट हो गया टेस्ट कैविटी हो गया पल्प वस्कुलैरिटी टेस्ट हो गया पल्प ऑक्सीमेट्री लेजर डॉपर फ्लोमेट्री होता है रिसेंट टेक्नोलॉजीज होता है डुअल वेवलेंथ स्पेक्ट्रो फोटोमेट्री होता है थर्मोग्राफी हो गया ग्राउंड सरफेस टेम्परेचर हो गया ट्रांसमिटेड लाइट फोटो प्ली थर्मोग्राफी हो गया हार्ट टिश्यू teeth should be visually examined using the 3 as a normal appearing crown has life like a translucency and a sparkle ठीक है that is missing pulpless tooth teeth are discolored opaque and less lifelike in appearance should be carefully evaluated because the pulp may already inflamed degenerate or necrotic all discolored tooth need endodontic treatment staining may be caused by old amalgam restoration root canal filling materials and medicaments and systemic medications such as tetracycline staining many discoloration however are the result of disease commonly associated with necrotic gangrenous pulp internal external resorptions and carious exposure हो गया crown contours should be examined because fracture wear facets and restoration changes the crown's contours. The clinician should be prepared to evaluate the possible effects of such a changes on the pulp. Above us recommended endodontic treatment and crown restoration once a cracked tooth development system because of tooth cracks can lead to tooth fracture. The consistency of the hard tissue relates to the presence of caries and internal external resorptions. Obviously, an exposed pulp will require some kinds of treatment if the tooth is to be retained. Therefore, pulp exposure initially recognized on the radiograph should be reconfirmed by exploration or excavation. The technique of visual and tactile examination is simple. The technique of visual and tactile examination is simple. One uses one eye, one finger, an explorer, and the periodontal probes. Loss of translation, light color changes and cracks may not be appear in poor light. In fact, a illuminator may aid of detecting enamel cracks or crown fractures. Soft tissue हो गया जैसे कि gingiva. In soft tissue such as gingiva, deviation from the healthy pink color readily recognized when inflammation is present. Changes in color occurs and swelling and the consistency of soft fluent or spongy tissue differ from the normal healthy firm tissue and indicative of the pathologic condition. Periodontium हो गया the patient's tooth and periodontium should be examined in good light under their condition. For example, a sinus tract might escape detection if it is covered by saliva or an interproximal cavity may escape notice if it is filled with food. Visual examination should include the soft tissue adjacent of the involved tooth for detections of swelling. The three common periodontal probes of assessment used clinically are as follows. जैसे William probes, William periodontal probe हो This is characterized by a lack of marking at the 4th and 6th millimeter. University of North sinus tract opening into the gingival crevice or deep infrabony pockets may go undetected because of failure to use of periodontal probe. अच्छा साइनस ट्रैक्ट ओपनिंग इनटू द जिंजाइवल सर्विक्स में साइनस ट्रैक्ट खुल सकता है डीप इंफ्राबोनी पॉकेट्स हो गया मेगो अनडिटेक्टेड बिकॉज ऑफ फेल्यूर टू यूज ऑफ ओपनिंग इंफ्रा पेरिडोंटल प्रोब्स पेरिडोंटल प्रोब विलियम प्रोब पेरिडोंटल प्रोब टू assess the health and periodontium. Periodontal pocket probing depth must be measured and record bone loss of multi-rooted teeth can lead to defect in a furcation region. A significant pocket in the absence of periodontal diseases may indicate root fracture हो गया. Poor periodontal prognosis may be contraindication to root canal therapy. The classification of furcation defect is given in box. The crown of the tooth should be carefully evaluated to determine whether it can be restored properly after the completion of endodontic treatment. Finally, rapid survey. Grade 1. The entire mouth should be made to ascertain whether the tooth requiring treatment is a strategic tooth. Percussion हो गया. This test enable one of the evaluate the status of the periodontium surrounding a tooth. The tooth is struck a quick moderate below with low intensity. The tooth is struck quick, moderate below initially low intensity finger and with increasing intensity of using the handle of instrument determine whether the tooth is tender. A sensitive response differing from that of adjacent tooth usually indicate the presence of symptomatic apical periodontitis. A sensitive response differing from that the adjacent tooth usually indicates the presence of symptomatic apical periodontitis. Percussion is a simple method of testing. It may be misleading of used alone. To eliminate a bias on the part of patient, one must change the sequence of tooth percussion successive tests. Moreover, one should change direction of the blow from the vertical occlusal to the buccal or lingual surface. Vertical, horizontal. Crown strike a separate cusp in differing order. Percussion is used in the conjunction with other periodontal tests, namely palpation, mobility, depressibility. These tests help to collaborate the presence of periodontitis. Percussion is used to mobility is a test to use to evaluate the integrity of the attachment apparatus surrounding to the tooth. The test consists of moving a tooth laterally and it is socket by using the fingers or preferably or handles of two operative instrument. हो गया. Objective of this test is determine whether the tooth is firmly or loose attached to its alveolus. The amount of movement of indicative of the condition. The periodontium greater the movement of poorer and periodontal status. Test of depressibility consists of moving a tooth vertically in its socket. This test may be done with the fingers or instrument. When depressibility exists, the chance of retenting and the tooth ranges from proper hopeless. Miller's tooth mobility index is given in box 6-8. Palpation, percussion, mobility of depressibility test the integrity of the attachment apparatus. Periodontal ligament and bone are not diagnostic when the disease is confined within a pulp cavity. Tooth bite test हो गया. Bite test is useful in identifying a cracked tooth or fractured cusp. When pressure is applied in a certain direction to one's cusp or section of the tooth. It is also helpful in diagnosis cases wherein the pulpal pathosis has extended into the radiculus region causing apical periodontitis. The tooth sleuth and phrase finder are the popular commercially available device for bite test. Bite test हो गया. देखो बाई टेस्ट जो होता है, by defining the type of crack presence and assessment of the proposition may be determined, treatment of alternative can be determined. How sensitive? Cracks in tooth are divided into three basic categories जैसे crease line fracture, split tooth. Another method for detect tooth fracture transillumination. Clinician should not note whether the discomfort or pain occurs during the act of biting or during the release of bite force. Pain on biting symptomatic apical periodontitis. Pain on biting यानी जब हम किसी चीज़ को Waltons, according to Waltons, radiographs have been following indication help in diagnosis of artificial alternating the tooth, the periapical structure determine the number of location, shape, size, and direction of root and root canals. Assesses of anatomy, size, and alternation in the pulp chamber. Detect locate root tip prior to surgery. Estimate confirm the length of canal. देखो एंडोडोंटिक इमरजेंसीज हो गया जैसे कि इस कंडीशन एसोसिएटेड विद पेन एंड स्वेलिंग दैट रिक्वायर्स इमीडिएट डायग्नोसिस एंड ट्रीटमेंट. Pulpal pathologies and traumatic injuries are two most common. Pulpal pathology and traumatic injuries are two main common cause of emergency. Pain can originate from pulp or the periradicular areas. Pain जो होता है, pain can originate from the pulp or periradicular area. Pain in endodontic emergency is mainly related to टू फैक्टर्स. एक हो गया केमिकल मेडिएटर्स एंड प्रेशर हो गया, दूसरा केमिकल मेडिएटर्स कॉज पेन डायरेक्टली बाय lowering the pain threshold of sensory nerve fibers or by increasing muscular permeability and producing edema. Increased fluid pressure resulting from edema also stimulate the pain receptor. Endodontic emergency is defined as pain and swelling caused by inflammation or infection of the pulp or periradicular tissue necessitating an emergency visit to the dentist. Immediate treatment. Present the classification of endodontic emergencies okay जैसे कि before treatment. Endodontic emergencies presenting with pain and swelling crown originate fracture previously known as cracked tooth syndrome. Symptoms बिफोर ट्रीटमेंट कौन कौन सा एंडोडोंटिक इमरजेंसीज हो सकता है जैसे कि एंडोडोंटिक इमरजेंसीज प्रेजेंटिंग विद पेन एंड स्वेलिंग जैसे कि क्राउन ओरिजिनेटिंग फ्रैक्चर हो गया प्रीवियसली नोन एज क्रैक टूथ सिंड्रोम. सिम्टोमेटिक रिवर्सिबल पल्पाइटिस हो गया, सिम्टोमेटिक रिवर्सिबल पल्पाइटिस हो गया, सिम्टोमेटिक इरिवर्सिबल पल्पाइटिस हो गया. अच्छा ये दोनों ही इमरजेंसी के अंदर आता है. Symptomatic reversible pulpitis, symptomatic irreversible pulpitis, primary symptomatic apical periodontitis. Secondary symptomatic apical periodontitis, acute exacerbation of symptomatic apical periodontitis or chronic sepsis. Acute alveolar abscess and cellulitis. B हो गया traumatic injury से क्राउन और रूट का फ्रैक्चर हो जाना, टूथ एवल्जन हो जाना ड्यूरिंग ट्रीटमेंट हो गया, हॉट टूथ एंडोडोंटिक फ्लेयर्स आफ्टर ट्रीटमेंट हो गया, पोस्ट ऑब्चुरेशन पेन, वर्टिकल रूट फ्रैक्चर. मैंडिबुलर मोलर जो होता है ये मोस्ट कॉमनली इफेक्टेड होता है. मैक्सिलरी मोलर और मैक्सिलरी प्रीमोलर जो है ये बहुत ही ज़्यादा क्रैक्ड होता है. मोलर ओल्डर इंडिविजुअल्स मोस्ट फ्रिक्वेंटली प्रेजेंट विद COF. अच्छा यही है फ्रैक्चर. क्राउन ओरिजिनेटिंग फैक्टर है ये। इनकम्प्लीट वर्टिकल फ्रैक्चर हो गया इन्वॉल्विंग द पल्प, इसको कहते हैं COF, क्राउन ओरिजिनेटिंग फ्रैक्चर। ट्रीटमेंट इसका क्या है? रिडक्शन ऑफ ऑक्लूजल कॉन्टैक्ट, ऑक्लूजल कॉन्टैक्ट को कम किया जाए। रिडक्शन ऑफ ऑक्लूजल कॉन्टैक्ट रीस्टोरेशन से इसको ठीक किया जा सकता है। फुल ऑक्लूजन कवरेज हो गया, इमोबिलाइजिंग द सेगमेंट हो गया। एटियोलॉजी हो गया, नेचुरल प्रोडिस्पोजिंग फीचर्स हो गया, ऑक्लूजल एनाटॉमी हो गया, इंटरजेनिक हो गया, इंस्ट्रूमेंट यूज्ड हो गया, टूथ प्रिपरेशन हो गया, क्लिनिकल फीचर जैसे विजुअल एग्जामिनेशन हो गया, close examination of the crown of the tooth may disclose an enamel crack that may be better visualized by using the following method हो गया। fiber optic light हो गया, this is used to transilluminate a fracture line, most cracks run mesiodistally and are rarely detected radiographically when they are incomplete. बाइट टेस्ट और मिथाइलिन ब्लो से हम लोग वो टूथ फ्रैक्चर को डायग्नोस कर सकते हैं। Initial pulp diagnosis is reversible pulpitis based on no spontaneous severe pain. 2 weeks waiting period is recommended. The tooth is stabilizing. Endodontic emergencies during treatment जैसे कि hot tooth definition है tooth that is difficult to anesthetize, मतलब a tooth that is difficult to anesthetize is known as a hot tooth। इसको हम anesthesia से डिसेंसिटाइज नहीं कर सकते हैं, उसको हम लोग हॉट टूथ कहते हैं। दिस इज मोस्ट कॉमनली इनकाउंटर्ड इन अ मैंडिबुलर फर्स्ट मोलर जो होता है इसको सिंथेसाइज करना बहुत मुश्किल है, ठीक है ना। This is most commonly encountered in a mandibular first molar tooth wherein after the anesthetic block the patient may describe profound numbness of the ipsilateral lip and tongue but still may experience acute pain during the access opening procedure. Mechanism हो गया, there is a special case class of sodium channel and C fibers known as tetrodo tetrodotoxin resistant sodium channel expression से from TX sensitive to TTXR during a neuroinflammatory reactions and TTX sodium channel play a role in sensitizing C fiber. Hyperplasia, inflammation, hyperplasia of the clinically significant characteristic of sodium channel is that they are relatively resistant to lidocaine. These channels are 5 times more resistant to anesthetic than TTX sensitive channel. Hot tooth may be explained by the fact that TTR sodium channel may have been adequately blocked by the anesthetic. Inferior alveolar nerve blocking supplementing. अरे बाप रे, Epinephrine in interlocal anesthesia immediately before administration with a stabilized sodium bicarbonate (SOD) solution has been found to make onset of anesthesia much quicker in hot. Supplemental intraligamentary injections are also helpful and ensure profound local anesthesia. Supplemental intral alimentary injections are useful and helpful and ensure a profound local anesthesia for intraligamentary injections. Volume of 0.2 ml of local anesthetic is deposited slowly using 27 gauge short needle. Mesial aspect of first molar. Mesial aspect of first molar, either mesio-buccal or mesio-lingual, with the bevel facing root of the tooth. Needle is advanced into the periodontal ligament space until from resistance of encounter. The incidence of hot tooth is most commonly encountered in mandibular first molar. ज़्यादातर जो है ना हॉट टूथ देखा जाता है मैंडिबुलर फर्स्ट मोलर को, ठीक है। मैंडिबुलर फर्स्ट मोलर मैंडिबुलर है, ये वाला हॉट टूथ हो जाता है मैंडिबुलर फर्स्ट मोलर नीचे वाला। Preoperative history of pain, pulpoperioapical status, shaping errors, over instrumentation, incomplete or under instrumentation, improper shaping technique, irrigant extrusion हो गया, retreatment cases हो गया, pulpoperioapical status हो गया, teeth with acute alveolar abscess हो गया, have the highest incidence of flare up shaping errors. देखो पोस्ट ऑब्जर्वेशन पेन क्या होता है आफ्टर कंप्लीटेशन ऑफ आरसीटी कैनाल ट्रीटमेंट RCT patient usually complain of pain, especially on biting and shaving more. The post-operative discomfort is encountered in endodontic treatment of posterior tooth. Etiology over instrumentation. Post-operative discomfort in encounter endodontic ट्रीटमेंट ऑफ posterior tooth, जैसे कि etiology हो गया, ओवर इंस्ट्रूमेंटेशन हो गया, persistent periopical inflammation हो गया, ये ओवर इंस्ट्रूमेंटेशन हो गया, या ओवर फीलिंग हो गया, ज़्यादा भर गया, मिस्ड कनाल कनाल नहीं भरा गया, मिस हो गया, हाइपर ऑक्लूजन हो गया, हाइपर ऑक्लूजन हो गया, पुअर कोरोनल सील हो गया, फ्रैक्चर ऑफ क्राउन और रूट हो गया. इसका मैनेजमेंट है कि जनरली देयर इज सम डिस्कम्फर्ट फॉलोइंग ऑब्स्ट्रक्शन दैट subsides in 2 to 5 days. Pain that persists beyond this period should make the operator reassess the treatment performed. Vertical root fracture हो गया. Vertical root fracture are longitudinal fractures that originate in the root of tooth and with few exceptions. These fractures occur almost exclusively in endodontically treated tooth. Etiology के root anatomy, amount of remaining sound tooth structure, loss of moisture in dentine, amount of bony support, pre-existing cracks. The roots that are narrower in the mesiodistal dimensions are more susceptible to VRF, such as those in a maxillary, mandibular, premolar, mandibular, molar, mandibular incisor, mesiobuccal roots of maxillary molar. Clinical picture क्या है? The condition presents with a challenging diagnosis, however, explorating surgery aids in definitive diagnosis of management हो गया. When a longitudinal fracture of a root occurs, the prognosis for the root is usually hopeless. देखो endodontically treated tooth है अगर, they have to be extracted if they cannot be restored, hence extraction such a tooth of a recommended treatment of choice. जैसे कि देखो endodontic emergency presenting with pain. Pain is one of the oldest universal medical and dental problems. Management of pain is endodontic is primarily achieved by combination of endodontic therapy and pharmacotherapy. How two groups of analgesic that are commonly employed are established in box. जैसे कि सबसे पहले हम pre-operative NSAID given in 1 hours before the administration of the local anesthetic can enhance the effect of depth of local anesthetic. मतलब लोकल एनेस्थीसिया जब हम देते हैं तो उससे 1 घंटा पहले हम उसको NSAID दे देते हैं, नॉन स्टेरॉयडल एंटी इन्फ्लेमेटरी ड्रग दे देते हैं जो 1 घंटा पहले. The first line of management is always restricted to the use of non-narcotic analgesic. Opiates नहीं दे सकते. Acute emergency combination of NSAID and opiates is preferable. बहुत ज़्यादा इमरजेंसी हो गया तो हम कॉम्बिनेशन दे सकते हैं एनसेट का ऑपिट्स के साथ। The penicillin was first antibiotic to be discovered in 1928 by Alexander Fleming. Antibiotics are substances that are produced in very low concentration by microorganisms to suppress or kill other microorganisms. Antibiotics are drugs that attack cell structure and metabolic pathway of bacteria but not human cells and play a key role in controlling bacterial infection. Antibiotics are not required for all endodontic cases. It is a common error to prescribe antibiotics for patients reporting with severe endodontic pain. देखो जे शेप रिटिलेशन सी है, ठीक है ना। वर्टिकल रूट फ्रैक्चर, वर्टिकल रूट फ्रैक्चर और डिस्टल रूट ऑफ द मैंडिबुलर मोलर। फार्माकोथेरेपी हो गया, फार्माकोथेरेपी ऑफ द एंडोडोंटिक पेन मैनेजमेंट हो गया, जैसे नॉन नार्कोटिक एनाल्जेसिक्स हो गया, एसिटामिनोफेन 1000 mg एवरी 6 to 8 आवर्स हो गया। नॉन स्टेरॉयडल एंटी इंफ्लेमेटरी ड्रग्स हो गए, इबुप्रोफेन, कीटो कीटोरोलैक हो गया, पायरोक्सिकैम हो गया, डिक्लोफेनाक हो गया, सोडियम पोटेशियम, ओपिट्स, कोडीन, ट्रामाडोल। Antibiotics are only required in case of endodontic infection with systemic sign of symptoms and not required for most endodontic condition. The common antibiotics used in endodontic emergencies, जैसे कि the endodontic emergency is presenting with swelling. So this section elaborate the management of swelling associated with acute alveolar abscess. Management of swelling associated with acute alveolar abscess, cellulitis, endodontic flare-up. Emergency treatment of supportive lesions involve establishing drainage. The procedure release the purulent periapical tissues, aids relative pain and pressure. Acute symptomatic होगा तो acute alveolar abscess symptomatic होगा following protocols, जैसे achieve drainage through the root canals, incision for drainage, needle aspiration, cortical decompression. Access opening. Establishing drainage through the access opening has been recommended as a means of reducing pain following the treatment of necrotic teeth presenting with swelling. Pulp is necrotic. Local anesthesia is not needed routinely. In fact, local anesthesia is frequently contraindicated in acutely inflamed tissue because its infiltration does not anesthetize the tissue. Acutely inflamed tissue has a localized pH, is acidic. In spite of body's natural buffering action, local anesthetic are effective in tissues. लोकल स्वेलिंग हो गया है, लोकलाइज स्वेलिंग हो गया ड्यू टू एब्सेस और सेलुलाइटिस. Endodontic pain है without sign and symptoms. Infection. Symptomatic irreversible pulpitis. Symptomatic apical periodontitis. Irreversible pulpitis होगा या apical periodontitis होगा. सबसे पहले एमॉक्सिसिलिन देते हैं. एमॉक्सिसिलिन दिस इज द फॉर्म ऑफ सेमी सिंथेटिक पेनिसिलिन विद अ broader spectrum of antibacterial activity. Amoxicillin is the antibiotic of choice of treating endodontic infection. Amoxicillin with clavulanate हो गया. Clavulanic acid is a beta lactam है इसमें, ठीक है. Inhibitors that is often used. Combination drug हो गया along with amoxicillin in order to overcome bacterial drug resistance. ये 6 to 5 mg हो गया. 5 to 7 day 1/2. क्लिंडामाइसिन हो गया. जिसको ड्रग एलर्जी होता है पेनिसिलिन से, उसको क्लिंडामाइसिन देते हैं, ठीक है. 600 mg 5 to 7 day. मेट्रोनाइडाजोल ये एंटी माइक्रोबियल है, इफेक्टिव अगेंस्ट एनारोबिक बैक्टीरिया. तो मेट्रोनाइडाजोल हो गया. मेट्रोनाइडाजोल का कॉम्बिनेशन है, ठीक है ना. तो दिया जाता है इसको एमॉक्सिसिलिन क्लेविलिनेट. सर मेट्रोनाइडाजोल यानी मेट्रोजिल देते हैं. ये अगेंस्ट एनारोबिक बैक्टीरिया के लिए होता है. इट इज यूजुअली गिवन कॉम्बिनेशन ऑफ एमॉक्सिसिलिन एंड सीवियर इन्फेक्शन. इन्फेक्शन सीवियर होगा तो उसको हम मेट्रोजिल यानी मेट्रोनाइडाजोल का कॉम्बिनेशन भी देंगे और एमॉक्सिसिलिन विद क्लेविलिनेट भी देंगे. प्रेगनेंसी में हम लोग सिफ्लोस्पोरिन देते हैं अगर प्रेग्नेंट है तो. 500 mg every 12 hours for 5 days.